It's that time again where kids have gone back to school and flu season is underway, which can oftentimes mean more visits to the doctor. Here today to talk to us about selecting the right primary care physician that can meet the needs of you and your entire family is Dr. Amanda Smith with Baptist Medical Group. Welcome to Coming of Age, Dr. Smith. We are so excited for you to be here. I'd like to start the show if you can tell us a little bit about yourself and what made you become a family medicine physician.
Okay, well, I trained in family medicine at the University of Mississippi Medical Center in Jackson, Mississippi. I've lived most of my life in Mississippi, so this is a new move for me. But I'm really excited to be in the Panhandle. It already feels like home. And it seems like every day I meet somebody that's from Mississippi, so I've about decided it's just an extension of that state.
Close enough to being home, and plus, it's always good to have the white beaches in your backyard.
It's beautiful. It really is.
So we're here to talk about how to pick a primary care physician. So if you can tell us a little bit on what's the process in selecting one.
Well, it's really important that you find a doctor that you fit with. Not every doctor fits with every patient. Not every patient fits with every physician. So you want to find a physician that really understands your pathology and the diseases that you've dealt with, but also to realize that it's a team approach, that the patient has to do his or her part, as well as even the family has to be involved. And that's where I like the family medicine aspect of that.
Definitely. I know I've had a few primary care physicians that weren't exactly the right fit for me, but I think I finally found one that I really like. Is there a resource you can go on to where you can look and see what maybe they specialize in? Is that on the Baptist website?
It sure is. Yeah, you could just look up Baptist Health Systems or Baptist Medical Clinic. My clinic's in Perdido. We're a relatively newer clinic, and it's just that's a great place to start with.
Well, let's talk about your practice. Do you have a specific age range that you cover? What does family medicine cover as far as ages?
Well, that's one reason I went into family medicine is I loved pretty much everything that I studied in medical school. But the thing that I loved the most was I had a chance to set up relationships with my patients. And family medicine in the outpatient clinic setting does that better than any other specialty. I love the little ones, the little babies, and I can treat their acute illnesses. I also love preventative medicine for all ages. I do, of course, women's health screenings. And of course, I love the elderly population. I think particularly as we get older, the disease pathology and the things that we deal with as we age is real important to understand.
And what are any specific illnesses that you focus on?
Well, my main thing is preventative medicine. I think any family medicine physician really enjoys that because it's important to kind of stop things before they get started. That's always the best way to do it. But the other thing that I like about family medicine is that you get those second and third and fourth and sometimes fifth or sixth chances to kind of fix things before it goes too far into the disease. So on most chronic illnesses I will deal with, and if I can't, I'll be real honest and we'll get you the subspecialist that you need to see. But also dealing with acute illnesses, like once you're established with me, you got that cold or something that needs to be seen quickly, we try very hard to get you in as quickly as possible. I also love doing small procedures, some things like cyst removals or joint injections that may take a while to get in to see a specialist, or you don't want to sit in the ER. We can get you in and get you out fairly quickly to take care of those as well.
That's always really nice because it can be a pain to have to go to multiple different doctors. It's so nice to have a family care physician that can do a little bit of everything so I can get it all handled in one place. I like to stress to a lot of our elderly clients, it is important to go to the doctor. It's important to go see them even if you have a small cold. You know, flu season's coming up and that's extremely serious for seniors. So can you talk to us a little bit about how can you prevent that? What are the steps that need to be taken now?
Sure. Well, with anything, wash your hands. Anytime you're around someone that is ill, particularly if you're aging and already have some diseases that you deal with, it's real important that you wash your hands before you eat or before you touch your face or your eyes. It's also important that if you are around someone with the flu and you know that they have the flu, and you start having symptoms, that you get to your doctor as quickly as possible. The medication that treats the flu is important to start within those first 24 to 48 hours to really help decrease those symptoms and the length of the illness. And that's really a lot different than what we as physicians say for most illnesses. Most illnesses, the common cold, if you will, we want you to wait a week, maybe two, to see if your body can fight that off. But if the flu flu, if you know that you have it, it's real important that you get in. Or if you just want to be tested, there's a quick test for that. Now, as far as prevention, there's the flu shot, and I try to talk to every person that comes in. It's a dead virus, so most anyone can take the shot. Now, there are a few people with allergies to certain things that are in that vaccination that may prohibit it, but even some people with, if the allergy is not too severe, they can still get that shot. So it's real important that you talk to your primary care doctor about that, about receiving it.
And in order to get that shot, is that something that they would just need to make an appointment with a primary care physician, or how does that work?
Every clinic does it a little bit differently. If you haven't seen your doctor in a while, go ahead and make that appointment to do your yearly and get that flu shot, and just get everything covered for the year. But if you've seen your physician recently, you can always call and talk to his or her nurse and see if they offer a different route to come in quickly and get the flu shot.
That's a good point that you make, is how often are we supposed to be going to the doctor? Is it only when we get sick? Should there be annual appointments? What is that like?
Well, it's really important that you do establish with your primary care doctor. So like we were saying earlier, if you got to get in quicker to see him or her for that cold, it's real easy to get in a lot quicker. So about once a year, generally speaking, for the general population, but some people need it much sooner than that. So sometimes every 6 months, every 3 months if your physician tells you so.
So you see people of all ages. So if a whole family wants to come in, can they get enrolled with you?
Right, just call and we can set up an appointment. I usually don't like to have everybody in the room, but we will do maybe 2 at the time, because sometimes the spouse will say, well, my husband or wife probably could tell you better than I could. So I don't mind having at least 2 people in the room that can kind of help, because that's sometimes part of it too. But yes, we can see the whole family.
And why is it important to be established with a primary care physician, other than, if you have some acute illness that you need to get taken care of? There are other reasons, like mammograms. What are some of those reasons? Well,
of course, mammograms for the most women over 40 and over 50, depending on their background. Colonoscopy starting at 50, the flu vaccine, of course, the pneumonia vaccine, shingles vaccine, just to kind of discuss with your doctor, say, hey, what all do I need to get? And then, of course, some other things other than that, more specific. But as far as which physician that you need to find, there again, it's what's called a family medicine practice. So in other words, it is a relationship that's set up. And kind of we talked earlier about there's one that will fit for you, maybe not for someone else, but it's important to find that and just have that taken care of. And that's something you don't have to worry about when you do finally have an illness and are frantically looking for someone to help take care of you.
Absolutely. It does become a relationship. I know my primary care physician, she can remember back to when I played the flute in high school. And I'm like, how do you remember that? So do you take those extra steps to form that personal relationship with patients?
That's right. It's important that your physician knows your history, not only your family history and your medical history, but your social history too, because all that makes up who you are, and who you are is very individualized in the way that your body reacts to diseases or things that come your way. So all that does come under that heading of family medicine.
Absolutely. And if we're going to wrap up the show here, but if viewers want to get more information about your practice or to find a primary care physician, what's the resource that they need to go to?
Well, they can always call the office, and if they were just riding around in Perdido, we're on Sorrento Road. It's fairly easy to find, Baptist Medical Clinic in Perdido. And
then the website for Baptist, what is the website for them? It's the Baptist Healthcare. You can probably just Google it and find it.
Unfortunately, that's what I do.
And then they have profiles for all the doctors.
That's right.
So it's easy for them to look. And
yes.
So if people want to just go in and try out like an initial appointment to see how it is and just kind of get to know a doctor before they decide, hey, this is what I want to do, can they do that?
One thing I really like about Baptist is that each physician, you can see their face and you look at their history, where they've come from, but they also answer like just some basic frequently asked questions, kind of like what we're doing here. And so you can kind of get to know the physician before you actually go into the office.
Wonderful. Well, thank you so much, Dr. Smith, for being here.
Thank you.
We really appreciate you coming on Coming of Age.
Thank you. I appreciate it.